USMLE Step 1. Test question formats. Single item questions. A single patient-centered vignette is associated with one question followed by 4 or more response options. The response options are lettered A, B, C, D, E. A portion of the questions require interpretation of graphic or pictorial materials. You are required to select the best answer to the question. Other options may be partially correct, but there is only one best answer. This is the traditional, most frequently used multiple-choice question format on the examination. Strategies for answering single one best answer test questions. The following are strategies for answering one best answer items. Read each patient vignette and question carefully. It is important to understand what is being asked. Try to generate an answer and then look for it in the response option list. Alternatively, read each response option carefully, eliminating those that are clearly incorrect. Of the remaining options, select the one that is most correct. If unsure about an answer, it is better to guess since unanswered questions are automatically counted as wrong answers. Example. Item: a 32-year-old woman with type 1 diabetes mellitus has had progressive renal failure during the past 2 years. She has not yet started dialysis. Examination shows no abnormalities. Her hemoglobin concentration is 9 gdl, hematocrit is 28%, and mean corpuscular volume is 94 Ma3. A blood smear shows normochromic normocytic cells. Which of the following is the most likely cause? A. Acute blood loss. B. Chronic lymphocytic leukemia. C. Erythrocyte enzyme deficiency. D. Erythropoietin deficiency. E. Immunohemolysis. F. Microangiopathic hemolysis. G. Polycythemia vera. H. Sickle cell disease. I. Sideroblastic anemia. J. B. Thalassemia trait. Answer D. Scene script. Note: some item types that appear on the Step 1 examination are not depicted in the sample items provided in this booklet, e.g., items with multimedia features such as audio. Also, when additional item formats are added to the exam, notice will be provided at the USMLE website. You must monitor the website to stay informed about the types of items that occur in the exam, and you must practice with the downloadable sample test items available on the USMLE website to be fully prepared for the examination. The following pages include 119 sample test questions. Most of these questions are the same as those you can install on your computer from the USMLE website. Please note that reviewing the sample questions as they appear on pages 851 is not a substitute for practicing with the test software. You should download and run the Step 1 tutorial and practice test items that are provided on the USMLE website well before your test date. The sample materials available on the USMLE website include an additional item with associated audio findings that does not appear in this booklet. You should become familiar with this item format that will be used. Voiceover. Now, let's dive into Scene 5, where we discuss the dynamics of the real examination and share some preparation tips. The sample questions provided are meant to represent the overall content of the Step 1 examination, but they may not reflect the content coverage on individual examinations. In the actual exam, questions are presented in a random order, not grouped according to specific content. These questions are designed for easy on-screen reading and may include the use of the USMLE laboratory values table and various pictorials. Please note that the quality of photographs, charts, and X-rays in this booklet may not be as high as those used in the actual exam. However, you will have the option to adjust the brightness and contrast of pictorials on the computer screen during the test. To simulate the exam's timing, allow a maximum of 1 hour for each 40-item block and a maximum of 58 minutes 30 seconds for the 39-item block, totaling 2 hours 58 minutes 30 seconds. Remember that the third block has 39 items instead of 40 because the multimedia item has been removed. Most examinees perceive the time pressure to be greater during an actual examination. Therefore, it's crucial to practice with the downloadable version to become familiar with all item formats and exam timing. In the real exam, answers will be selected on the screen. No answer form will be provided. Lastly, an answer form for recording answers is provided on page 52 of this booklet, and an answer key is provided on page 53. Remember, preparation is key to acing the USMLE Step 1 exam. Good luck.